Hi everyone, welcome to part 2 of Immunity and Growing Your Own. So today I'm talking to you about vitamin D. I was actually planning to be outside in the sun talking about how to grow my own vitamin D, but unfortunately as soon as I set up, the clouds came over and it's now freezing, so I'm back inside. So vitamin D. Vitamin D is actually a steroid hormone rather than a vitamin. Although a small proportion of vitamin D comes from our diet, what we eat, we actually make most of our vitamin D ourselves during the summer when UVB rays hit the surface of our skin. So some people who are high risk of fracturing their bones, have muscular problems such as multiple sclerosis, or have known low levels of vitamin D actually take a supplement. After winter, however, most of us are actually deficient in vitamin D, and some of those people take a supplement during winter to prevent this. People with darker skin, those people that don't get outside much, and people that cover their skin can be vitamin D deficient all year around. Vitamin D supports the immune system, but it's also required for the maintenance of bones, teeth, muscles. It's required for the normal absorption of calcium and phosphorus and to maintain normal calcium levels as well. So you may have heard rumours about vitamin D being used during this COVID-19 pandemic. Some people, including scientists and news reporters, can't understand why governments are not recommending vitamin D supplements to help everyone prevent the spread of the virus and reduce the number of deaths we're seeing. The truth is that governments can't recommend anything until evidence is available for this specific virus. Based on work from other types of coronavirus, some scientists and doctors are recommending that vitamin D levels are tested on hospital admission, and if they are low, so insufficient or deficient, then levels are quickly supplemented. This is because in other coronavirus infections, low levels of vitamin D increases the risk of death, increases the risk of fibrosis of the lungs and acute respiratory distress syndrome, also known as ARDS. In infectious diseases in general, vitamin D supplementation is known to increase immunity, reduce inflammatory responses and reduce the risk of a respiratory tract infection. So luckily there are a few trials to do with COVID-19 and vitamin D which are just beginning to recruit patients, although their results won't be available for a few months now. These trials have been registered in the USA, France and Turkey, and will look at vitamin D alone or in combination with vitamin C and zinc or a particular drug. My favourite trial is a study across several hospitals in France. They're looking at COVID-19 positive patients of 70 years and older with normal or insufficient or deficient vitamin D levels in their blood. They're seeing what impact a dose of 50,000 international units a day or 200,000 international units a day has on survival, and they expect that their results will be available to us in July. In all of these trials, very high doses of vitamin D are suggested, but this is only ever recommended for anyone in the short term. Some scientists feel even having very high levels of vitamin D in the blood may be a good idea at reducing infection risk at the moment. However, we just don't know enough about this yet to recommend it. Regardless of any results which may come, and regardless of any pandemic that we're ever in, it's never a good idea to be insufficient or deficient in vitamin D. If you have low levels or think you are high risk of having a low level, then please speak to your medical team.